Go live. I think it's actually going. I say this every time.
I think we're live.
Blathering on. Oh, we are live.
Zoom says we're live.
All right. Hi, everybody. It's Monday, November 16th, 2020. I'm Lucy McBride, and with me tonight is my dear friend and medical colleague, Dr. Clay Ackerly. We are here to talk to you about the upcoming winter months in a pandemic, the latest COVID news, some of which is very exciting, some of which is grim and really bad. And then hopefully to answer some of your questions about how to get through the next couple of months safely and maintaining some semblance of sanity. So, Clay, thank you for joining me on this 9th Q&A with Lucy and Clay.
It's great to be back. Thanks, Lucy.
It's fun. I love that. It's great to be back.
Fun. It is good to be back.
It is, right?
I'm glad we can say that. Yeah.
Totally. It's good to chat and share ideas, and I'm gonna pull up Facebook here so I can see what people are asking us in real time. So you and I are talking a little before the show about the grim reality at this moment of the COVID numbers and the surging cases across the country. Yeah. Paired with some hopeful news and how there's this kind of, horrible situation we're in, yet a little bit of hope and light at the end of the tunnel. So what do you think? How do you reconcile those two things at once?
Yeah, I think it's just a timing issue, right? All this good news is happening, but you have so much virus in the community and you're entering winter, right? The virus spreads more easily in cold, dry air. People are heading indoors. People are tired, and that's a problem, right? But the good news is not going to suddenly evaporate all of the particles that are around and inside us and suddenly make us disappear. So it is a grim reality with the number of cases that are ongoing, the number of our patients we're hearing from on a regular basis either have COVID or have contacts, high-risk contacts with people with COVID. So that's a real challenge. But the good news is if you can, all the stuff we've been saying from episode number 1 to keep yourself safe hasn't changed, right? So going back to those basics and protecting yourself and your loved ones through the winter. I am, as I've said in my emails and letters, I'm a December pessimist, but a March optimist, right? The vaccine news, the therapy news in terms of the antibody therapies and elsewhere are really exciting things that don't change the reality on the ground of the amount of virus that's just everywhere.
Right. And as I've been saying to my patients and readers, like you have, the virus really hasn't changed since it landed on planet Earth. It's that human behavior has, and behavior is still our best defense against the virus. It's just really hard to hang on and really hard to double down on risk mitigation measures when we're this far into the pandemic. We have COVID fatigue. We want to see our friends. But the truth is that the more we can act as if everybody that we see around us has COVID. I mean, I'm sort of guiding people to just assume people have COVID and then behave as if they have COVID. So that keeps you distant, it keeps you masked, it keeps you from gathering inside. I think we just have to assume people are guilty until proven innocent, given the prevalence of the disease in so many communities.
Yeah.
So it does pose a problem for Thanksgiving, right? I mean, as I've been saying to patients, if you're on the fence about going somewhere, just don't go. The safest thing to do over Thanksgiving is not to travel and to celebrate the holiday with your household. The next safest thing is to quarantine for 14 full days, which, by the way, you should be quarantined right now if you're going to do a 14-day quarantine in advance of travel. And then ideally get tested before you traveled. Travel safely, meaning by car or by foot, if possible, over airplane.
Don't catch a cold.
Yeah, and then get tested on the other side. Ideally at least 4 days after travel, and then do the whole thing all over again. But again, the safest thing to do is not to travel, not to go anywhere, and to hold on tight with the understanding that it will be better, next Thanksgiving, but certainly before that. And we'll be
Yeah.
able to celebrate with family and friends once we have the vaccines widely distributed, once we've got these new therapeutics in regular, usage. So
Yeah, on the whole, like, next Thanksgiving
yeah,
idea, I just have a hard, and I understand that there's certain doctors and experts out there that may be seeing different things than I am, right? But there are a number of people out there still saying, oh, it's not going to be back to normal till 2022, right? Even Dr. Fauci a couple months ago was cautioning, about that. Now with the first two vaccines out of the gate looking effective, both, we still need to see the safety data, but that is really reassuring to me. Again, December pessimist, March optimist. They're going to have a decent number of people vaccinated by springtime and going into summer.
oh yeah,
Right? Where the fall of 2021 should look, yes, we're going to be wearing masks for a long time. Don't define mask wearing as a new normal, but like, yeah, you're going to go to the movie theater probably if you like going to movies, and you're not now totally hooked with your home TV setup. And wear a mask just because, right? Because you now feel more comfortable.
Yeah, handshakes are probably forever out of vogue.
Yeah, a little bit unnecessary, but I'll probably be hugging more people, right? Missing. I got a lot of, like, my hug bank is really depleted right now, and maybe no formal handshakes, just a good hug for the people I haven't had to, been able to handshake for a while. But I just don't see it taking that long.
Yeah, I agree.
Because of that, you should be able to cancel, hopefully, your Thanksgiving much more easily to say, we're going to get together again soon.
Yeah, short-term gain, a short-term pain, long-term gain. I mean, I agree with you, Clay. I was talking to my son who's a freshman in college right now, and how, hopefully fall 2021 will be a do-over, like kind of normal-ish college. Because, right now it's basically, a police state, which, understandably it has to be like that. But I do think that the promise of the Pfizer and the Moderna vaccines, of course, we don't have all the data. We don't know about safety and long-term effects, but so far it's looking very, very hopeful.
Yeah, I mean, efficacy alone was never guaranteed.
Right. We were never guaranteed to have anything.
And so, let's just say there's some safety signal that we need to tease out. We wait a couple more months while they continue to make tons of vaccine, right? We say, okay, do the risk-benefit calculation. For those people who want to sign up and get it, they can get it. The efficacy at some level, at least in the short term, looks good enough that I think with that vaccine, can you begin, it's not 100%, but can you begin to, go back to normal behavior? I think so. And there are a lot of people who are concerned about, oh, what about all the people who don't take a vaccine? Good news about those people is, you can get your vaccine faster. At some point, we'll deal with the rest to get to full herd immunity and stamp this virus out. But in the short term, I'm less concerned about virus hesitancy, because for the people who really want it, it's going to make it easier to get it.
Yep. Yeah. Someone has a great question here. Laura, please talk about the Hopkins study that's using plasma as a preventative for people who've been exposed to the virus. So, I mean, one thing I might mention before even talking about the plasma as preventative would be the kind of the cousin of that that's actually has an EUA from the FDA, which is this monoclonal antibody treatment for people with newly diagnosed COVID. The Hopkins, I think that the plasma as preventative for people who've been exposed is, it's super, super early. It stands to reason that would be reasonably effective, but I just, I think that is, we just don't have enough data on it. But what do you know anything more about that, Clay?
I'm not sure about the specific Hopkins study, if it's a discussion about convalescent plasma as a prophylactic
for high-risk exposures.
For high-risk people with high-risk exposures, would make sense that it could potentially help by giving you some, antibodies. Now we're soon to get vaccines. The antibody treatments themselves are targeted antibodies.
Yeah.
They have a lot fewer potential complications than the convalescent plasma. So my guess is, given the positive information we've been seeing from the Eli Lilly and Regeneron antibody treatments, so instead of getting all of the antibodies that a patient has, a lot of which will be to COVID, but to everything else, you're getting targeted COVID antibodies. So
Yeah.
I'm thinking less about convalescent plasma, much more
Say-
about how do we get access to the antibody treatments early in disease.
Yeah, just to be clear, I think people understand this, but so convalescent plasma was a buzzword, right? Back in the summertime. Convalescent plasma is that sort of straw colored part of people's blood that has a whole lot of antibodies, but it also has other things that you don't necessarily want, like the other antibodies that you don't need, plus clotting factors. So it's not a risk-free endeavor to take convalescent plasma, which
Yep.
is why what's been newly approved, the monoclonal antibody treatments, is sort of like a cleaner, souped up version of convalescent plasma in that it takes the antibodies from people who have convalesced or recovered from coronavirus, from COVID, and they engineer those antibodies in the lab, and then just hone in on that specific antibody targeted to the proteins in coronavirus. So it's much cleaner, it's safer, and so far is showing great promise. And as Dr. Ackerly and I have been talking to our patients, it's possible at this point in a clinical trial to get access to these drugs. The qualifications are that you have to have early COVID, you have to have a diagnosis, PCR proven, and not be hospitalized, but rather be in the first 10 days of symptoms to qualify for getting it. You also have to, I believe, have a risk factor for poorer outcome. So
it depends. I mean, that's the EUA. That was the
that's
EUA.
the EUA. That's right.
Yep.
Yeah.
Sure.
So that is very exciting, and showing promise. And Clay, Dr. Ackerly, and I both listened to this podcast called TWIV, This Week in Virology, that gave a really nice update on the status there. But that is showing promise because, as you all know, before this EUA was issued, we really didn't have any treatments for people who are not hospitalized, for people who are newly diagnosed and not sick enough to be in the hospital, treatments to prevent hospitalization. So this is why monoclonal antibodies are exciting.
It's a game changer, right? Before
it is a game changer.
It was like rest up, hydrate, take Tylenol, Advil, stretch, sleep, and let's hope that you kick it, right? This is now something that can prevent hospitalization. 75% reduction in the clinical trial that got the EUA. 75% reduction in hospitalizations and ER visits. That's a big deal. So early testing, early diagnosis, getting that treatment early seems to make a difference. And it's something that, now has changed the game in my mind of early testing and diagnosis, because we now have something to give you to keep you out of the hospital.
Leslie, an EUA is an emergency use authorization. It's a regulatory word that I didn't know a whole lot about, that gives approval to a promising drug before it's officially FDA approved. What's the difference, Dr. Ackerly, someone's asking, between the antibodies generated by a vaccine versus the antibodies generated by getting the coronavirus itself?
It's a fantastic question. It's a really good question. I don't want to dive into too many details, but I think you need to think about a couple of things. One is the vaccine may be less effective or even more effective than catching COVID, right? The amount of an immune response that you make does depend on, did you get severe COVID or light COVID? So trying to make a comparison to say, would I rather get COVID and this whole herd immunity through catching it versus herd immunity through a vaccine, it's really varied about how much of an appropriate immune response you're going to have to catching COVID. So, but the potential there is that you're going to make antibodies to every piece of that virus, the spike protein, the nucleocapsid, all the bits and pieces of SARS-CoV-2 you can target if you get infected by the whole virus, right? For the vaccines, most of them are really targeted to the spike protein. So one potential risk, although it's been shown that doesn't seem to be a concern, is that either the antibodies you make to spike could perhaps cause some other issues and some complications, right? Maybe the reason why COVID itself is so damaging and some of the long symptoms you're having or some of the antibodies you make to the virus. So maybe the antibodies you make to spike would be a problem. Another issue is maybe SARS-CoV-2 mutates in a way that the actual spike protein changes. So we've got a lot of the vaccines are really targeting that spike protein. which is why the efficacy data of the Pfizer and Moderna vaccines is so promising, not only to those vaccines, but the rest of the vaccines that are targeting spike, to say, hey, if you target antibodies to the spike protein alone, you should have a pretty darn good response and be able to prevent infection from
Yeah,
COVID.
it is. That was a great explanation, by the way. And the other problem with, I mean, there's so many problems with getting an actual coronavirus infection, but one of them is that it triggers the immune system to overreact. And one of the working hypotheses is that the antibodies created by our own immune system can then go on and attack our own tissues. So you do worry that, you know, of course, one of the feared complications of getting coronavirus is not only the fever and the cough and the, you know, fatigue that can last for months and months, but the downstream sequelae on different organ systems because of our immune system's effect on our own body. So, you know, presumably, if you have a cleaner version of the virus, meaning a vaccine that's targeted to only one, you know, protein, that maybe wouldn't have all those immune
Yeah, and now
problems.
you've got the antibody treatments that are targeting spike and seem to
Yep,
be safe and effective. You've got the two first vaccines that are just targeting spike and they seem to be effective, and that's awesome. So I
it's
think
really
this
great.
sort of this spike hypothesis is proving out that all of the, you know, wonderful work in the biomedical community is paying off. There is that risk that maybe, you know, COVID suddenly changes dramatically, but my guess is if that happens, right, it's going to be a different virus. It may not be as problematic as an infectious agent. So that's a great question. There's more sort of nuances in the different types of vaccines, right? The mRNA vaccine versus the whole virus vaccine, that I think goes down a little bit of a rabbit hole. But again, it's a great question. And the different vaccines have different ways that they stimulate the immune system to create antibodies.
It's interesting how, you know, Pfizer, as people probably know by this point from the, you know, lay press, the vaccine has to be given in 2 doses, 28 days, I think, or 30 days apart. It has to be stored at very, very cold temperatures. And Moderna doesn't require that level of cooling. So that's an interesting feature of Moderna,
Yeah.
and potentially one that's going to make, you know, distribution administration a whole lot easier. But, you know, we have a lot further to go before we actually have it up and running. But
Yeah.
someone's
And one of
asking,
those, no,
go
go for it.
ahead.
Well, one of the questions was right about that, was asking about that, about why the difference. It's not entirely clear to me. They're both mRNA vaccines.
Yeah, I don't
It
know
may
why
just
that
be,
is.
I mean, the way that they're manufactured, there could be some patents related to it. I'm just glad that we now have what looks like, you know, the first 2 out of the gate are looking pretty good, and
It's
that's
really
exciting.
great. It's amazing. It's science working. It's
Yeah.
just incredibly cool. It's also, you know, it's emblematic of people working together and working so hard and, you know, sharing data and, you know,
I also want to warn people that, let's just say there's some bad news that comes out about this in the coming, you know, weeks and months. I mean, there's
which there
quote
could
unquote
be.
bad news about the AstraZeneca vaccine trial and the Johnson and Johnson, where they had to stop and take a deeper look at some of the safety signals. I have a hard time believing that this is going to be a clean win. There's going to be something that comes up, some concern, and that is okay. Right? With
Yeah.
more time, we're going to learn more. So I wouldn't, just because we're now, and so at least I feel like I'm on an optimism high about, you know, the EUA for the antibody treatment and both of these vaccines looking like they're effective. There's going to be bad news, and that's going to be okay.
They're going to be setbacks. It's like life, right? It's like it's not going to be a perfect straight line. It's absolutely not. I think that's a great point. So if Julie here were diagnosed with COVID, should she ask her doctor for monoclonal antibody treatment? I'd say absolutely yes.
No. Yeah.
Ask about it, because, you know, things are changing rapidly, and, you know, you might be lucky enough to have a physician who has access to a clinical trial locally. You could get an infusion. It's a one-time infusion, apparently over 15 minutes, and that could potentially keep you from getting sicker. So absolutely, it's something that you should be thinking about should you get diagnosed with
Yeah,
COVID-19.
I mean, I would talk to your doctor about it. You know,
Yeah, talk to your doctor.
do you have those high risk factors? Do you have the ability to go get it? It's not clear to me how our local hospitals, it's going to, because it's an infusion, it's being distributed through the hospitals. It's not clear how Sibley, how many doses they're going to get, but I know the clinical trial sites for both, Eli Lilly and Regeneron, and I'm very much encouraging my patients who catch COVID to enroll.
Yep. How do you think the vaccine will be distributed? Through one's doctor, through government-run centers? I mean, you gave a good description of this today, Clay, or last week to your patients, and then I hawked it for my newsletter for my patients today.
I don't think we know. I mean, the bottom line on that one is we don't know. There's going to be a lot of variation there. I think it's going to be distributed through hospitals and health systems first. The government's going to have its own way it goes through, probably, direct to nursing homes, and how that next phase of getting to CVS, Walgreens, our office is not entirely clear to me. But once it gets FDA approval, any of these vaccines, definitely keep your ear to the ground. And if you haven't called your doctor to say, hey, by the way, what's the latest word? Not to demand it tomorrow, because it's going to be a complicated rollout process. But my guess is we're going to blink and suddenly you can get your COVID vaccine out of CVS. Right? When that day is going to come, how they're going to do tracking, honestly, of who gets it and when. Be ready to give up a little bit of your privacy. There's a lot of good work going into trying to figure out how to track vaccine deployment, who is getting it, right? Have you gotten the first one? Have you gotten the first one of the two, making sure you get the second one so your first dose isn't wasted? I mean, it's going to be complicated and messy. So I don't think that's what I put in my letter, Lucy.
No, it's not. I was just punting the answer to the question to you because I think we don't know yet. But I'm actually getting a lot of calls. But I got a lot of calls today. I mean, the majority of calls today were, well, actually, I don't know because I don't answer my own phone really, but a lot of calls today about, I'm sick, I was exposed, I, am in a carpool with someone who is positive. I was hanging outside at a restaurant with somebody who turned out to be positive. I mean, I just am noticing the numbers in my own practice escalating as I think you are seeing too, Clay.
Absolutely.
And then I also got a number of calls today about, can I get the vaccine through you? And I wish I knew the answer to that. But I like that people are asking and people are paying attention.
Yeah. I was going to mention talking about people calling, getting sick. Do you want to talk about influenza?
Let's talk about that. Yeah.
I mean, so I had been very hopeful, right? It hadn't been seeing influenza. I haven't had a patient with influenza yet.
It's here though. It's in DC.
Here. So I think if you're talking to your doctor and you're now symptomatic, Sibley Hospital has talked about for patients showing up who are symptomatic, they now need to get tested for influenza and COVID. So if you haven't gotten your flu vaccine, please get your flu vaccine.
Yeah, it's a little earlier than most of us were expecting. I mean,
for sure.
But a pediatrician in town has had 3 cases of influenza B last week. It's definitely here, and as we know, it spreads in a similar way that coronavirus does. So presumably, what you're doing with masking and distancing and avoiding indoor spaces and hand washing should help. But we now need to have that on the radar as well as coronavirus, because they look similar in many ways.
Yeah. Agreed.
So here's someone's question. Thinking about how cases are rising in the DC area and community spread during and after the holidays. We're thinking about doing medical procedures. Should we do them now or do them later? I mean, it's very dependent on the person and the level of urgency. For example, a patient of mine who is newly recovering from breast cancer, her question was, should she get her mammogram, now or wait? And the answer is now, because, of her unique health situation. But she also asked me, should I go to the dentist? And she had been to the dentist in February and she doesn't have any teeth problems or complaints. So I said, why don't you hold off on that? Because we're trying to triage, do the most essential visits and then sideline the things you don't have to do until, we're safer, probably in the spring.
Absolutely. I think that the triage, quote unquote, there is really important. Do not lose sight of the things that are really important. With increased access to PPE, right? Masks and face shields and everything. And now with improved testing as well. In theory, offices should be safe and safer than they were back in March. You should be able to be safer going into those environments, but just don't risk it.
Yeah.
Don't risk it if your teeth have always been fine, you've always been fine, and it's just a routine cleaning. Sorry, dentist, I know that's important, but that's something that can wait.
I know. Sorry, dentist. My husband is convinced that the electric toothbrush is going to put dentists out of business. But then, I don't think that's true. I really don't. I think that, God bless dentists. I also think that, I think I'm biased, but I think people should come in for their checkup with their doctor. Now, it looks very different when people come in to see you and me, Clay, for their annual checkup. But, just today I saw someone whose blood pressure was out of control. Her blood sugar is out of control. She hadn't had her flu shot, and needed a mammogram. So, we had a brief encounter. We do most of our conversation on Zoom a day or so later with her lab results. But, I think right now, as it feels like the world is swirling out of control, you want to remember what you do have under your control, which is taking care of your underlying health conditions, managing your blood pressure, your blood sugar, and considering your health habits and thinking how you could improve your health habits as we kind of head down the barrel of what's going to be a very long winter as we wait for these developments to pan out.
And I love my patients, and maybe it's 5 to 10% of them who have really embraced some of the silver linings of COVID. And there's in terms of the ability to just have a little bit of breathing room and time at home, and they've embraced online activities and getting exercise. The vast majority of people, unfortunately, the stress of the situation has built up and it's led to one or more health problems. So it's very rarely now are my annual checkups without a lot of stuff to work on, right? And
I think that's so true. I mean, it is like a workshop, right? And there's a lot we can do. I know for you, Clay, you're like me. You're not interested in just checking the boxes. You want to help actually advance people's health and help empower them with the tools to do that. So, right now we have so little agency in terms of what we can do in terms of, when is the vaccine going to be out? When are the antibodies going to be available to us? When can I get my life back? When can I see my grandkids? But you can really, start to take charge of your health if you haven't already, and consider how best to get through the winter, because, and this applies to me completely as well. Like that the path of least resistance is to kind of, exercise less, eat more, kind of bury your head in the sand, which we all do because we're humans. But if you can hold on to hope that help is coming, and know that everything you do now to invest in your physical and mental health is going to pay off, it can help to visualize the spring when the sun is shining. We're getting vaccinated. You can start to plan your holidays, plan seeing your loved ones, celebrate anniversaries and birthdays again. Like your March body and mind will thank you now if you invest in your health.
I'm gonna put an exclamation point on. I
thank you so much.
I absolutely see a lot of people come April, May, June, as things really do begin to get a lot better, and look back in the winter and say, gosh darn it, it's sort of like spring cleaning. You want to do spring cleaning and you had that window and you got nothing done. Now's going to be a wonderful time to get a lot of stuff just done. And that should include your health, right? It's going to be hard to exercise when you're stuck inside. Figure out your exercise routine, right? If you do believe that your blood pressure is a little bit high, buy a blood pressure cuff, track it. If your sleep's not great, invest in trying to do sleep hygiene well, right? Talk to your doctor. If you're scared about going in to see your doctor, set up a telemedicine visit, talk through your issues, see if you need to come in. And if not, make your health plan for the winter. Because I think right as suddenly the world's getting back to normal and you've got a lot of built up sort of health debt that you need to then pay down, like it'll be what a wasted opportunity to spend that time when you can really invest, now. So
totally agree. It's like every January, I always admire people who come in like January 3rd, 4th, 5th for their annual checkup, right? because I'm like, wow, that's, they're either just really honest, or they just, they're not afraid. The point being that every January, right, we all see patients, and some of us may be in this category ourselves, where you're remorseful about what you ate, what you drank, how little you exercise, and how aggravated you are with, family and, your mother-in-law, blankety blank, right? And so, January is for a lot of people like dry January, and people spend January, February, March sort of like, cleaning up their act. So coronavirus in the last 8 months are kind of like that on steroids, right?
Yeah.
So know what you're capable of. Invest in your health now, because it will pay off. This will be over.
It will.
And you will be so much happier
Yeah.
if you spent this time, like you said, get that Calm app at bedtime. They have great bedtime stories. Take a little melatonin. It cannot hurt you, and it can only help with sleep if you have a sleep problem.
But I mean, those are great ideas. I would just say you don't need a solution on your own, right?
Yeah.
Talk to your doctor. And honestly, if you can't get a detailed conversation, go to a sleep specialist. I mean,
yeah, totally.
Talk to your therapist. Cognitive behavioral therapy for insomnia is like really effective. Make that to-do list of what that wish list looks like. And if you do a dry January, think about starting it early.
Yeah, start now. Start a dry. Yeah.
But all right.
Yeah.
That's a little soapbox, but I just
little soapbox.
You have to have some silver linings here. Come on.
Yeah.
You can do this.
Yeah. And just to nod again to the mental health piece, which is my favorite subject. If you're debating, should I see a therapist to manage my distress over parenting, teenagers who are, struggling with the pandemic? Should I see a therapist to help with my marriage, which is under strain, my work? Yes, don't hesitate. There are more online resources than ever at this point. There's support groups, AA is online. So, I think this is a good moment to really reach out and get the added support if you need it.
Great.
So what else can we answer here? Over-the-counter medicines for symptoms, headache and you didn't say god awful, but awful body aches. Advil and Aleve and typical NSAIDs are really the name of the game. Back in the spring, there was a suggestion that these medications somehow made the outcomes from coronavirus or COVID-19 worse, but that information has been tossed out. Advil and Aleve happen to be some of my favorite medications. They're great anti-inflammatories, so that's what I would start with.
Yeah, I just think if you got any health conditions, particularly high blood pressure, stomach ulcers, kidney dysfunction, just be careful. It's easy to overdo the NSAIDs. Have that Tylenol there as well. But no, I mean, I think they definitely were underused because of that scare back in the spring.
That French study in the early days.
There's one interesting question about, what freedom do the pharmaceutical companies have in deploying the vaccines? I think the easy thing to remember is that almost all of the initial doses of the vaccines were purchased by the government. So there's both two things. And Pfizer had an interesting thing in their press release and discussion about their vaccine. They didn't participate in Operation Warp Speed, which meant they didn't take government funding for the R&D portion of developing the vaccine. But they took a whole lot of money from the government when the government bought all of the initial doses. So the government basically is going to own all those doses and will have a lot of say in how they're dispersed.
I just want to say, comment on Sharon's lovely comment. Sharon has been such a lovely supporter of my newsletter that I write twice a week. She actually wrote me a poem on my birthday, and I do not know Sharon personally.
Oh, nice.
I know, she's so sweet. She lives as a 3-generation family, and they take, and one day a week they celebrate a foreign country. They cook country foods together, naan, enchiladas, French baguettes, depending on the country. They research country customs, the dress, music. I mean, that is a perfect example of, turning lemons into lemonade. So thank you for that, Sharon. That's awesome.
That is great.
What other questions do we have?
I see one joining late. Crystal ball question: are we headed to a quote unquote stay-at-home order in the DC area? I do think it's important to highlight the differences about what's happening now versus what happened in March. we know a whole lot more about the virus. And so I have no idea what Muriel Bowser is going to do, or the other officials. The rates are undoubtedly going to continue to increase. Right? But I think the, do not leave your home order doesn't feel right or necessary. I think increased restrictions on, restaurants and the like would make a ton of sense, as hopefully, the government continues to invest fully in trying to keep schools open. And I think that I put this in my letter, and that you included, Lucy, in your update. But January is going to be an interesting test. All right, I think about how much effort's going to be put into opening schools in the winter when we know there's going to be a ton of virus around. And I think we can. All right, I worry about pushing it all the way off until the spring and later, waiting for the vaccine to be available for everybody. We definitely need to make teachers, as much, as essential employees as possible. Schools need to have access to good, high quality PPE for teachers. And they should be, top of the list, hopefully, for getting a vaccine if they've got high risk factors. But the whole shutdown, I think, is a bit of a misnomer. Will we need to lock ourselves in for our own safety? Quote unquote. Like, if you're an essential worker, again, you're going to have more access to personal protective equipment. You'll know how to protect yourselves. It's safer to go to work than it was back in March or April. So I don't know. I don't know if that answers the question, Lucy. I don't know if you've got a thought on that.
Yeah, I mean, I think we know now, as you said, so much more about the virus and its transmission. And I think, we've learned again and again, and even as recently as last week, that, restaurants, bars, gyms, indoor venues are the biggest source of community spread, in addition to households.
Yeah.
Schools are doing a really good job of mitigating risk with distancing, de-densifying the classrooms, all the hand washing and hygiene precautions. And so, that's my mom calling me on the phone. And so, I agree with you. I think most people would agree that we should prioritize schools over bars. And hopefully we can do that.
Yeah.
And hopefully, this is where testing comes into play.
Absolutely.
Testing, we're in a much better place than we were back in the spring and even back in the summer, remember back then when we had to wait 2 weeks for a result, which at that point rendered the test pretty useless. I mean, that was ridiculous.
Yeah.
Now we're able to get much more real-time results. And so I'm hopeful that we'll be able to keep schools open with even like pooled saliva testing or more surveillance testing. And, so I agree with you. I don't think we're gonna have a full shutdown.
Yeah, I mean, the testing is nice and important to make sure you don't have something running rampant within your schools. But I think, with a ton of community spread, I mean, there may be a student who shows up and has COVID, right? But you've done all the things to keep that environment safe with de-densification, mask wearing, good ventilation, where that student, presumably will be asymptomatic at that point, is not going to be shedding a ton of virus. So I think the bigger thing, honestly, is testing for contacts and testing for people with symptoms, so you can hop on that person, and hopefully we can get the virus levels down enough that, this is now looking into probably February, where contact tracing will become useful again.
Yeah.
Like, how do we actually stamp this out is doing really good contact tracing and getting the last pools of virus out of the community. So we've had questions in the past about the whole contact tracing app. Please, everybody download it. Right now, I'm not sure it's all that useful because not enough people have downloaded it. They're not using it. If you get test positive, you have to remember to upload your diagnosis into the system. But right now, everybody's phone is probably just going to go crazy with pings because there's been enough movement. But I think testing will be crucial at trying to get that curve back down steeper, faster, even as vaccines ramp up. And I think we should have confidence in the school environment, even if testing isn't happening like daily for everybody.
Yeah, I mean, you and I have been talking about this from the get-go. There's not going to be one single thing that's going to get us through this. You know, when the vaccines are released, it's not like we can, you know, take off our masks and start, you know, gathering in bars and pubs, right? We need all of these things to be working in tandem. We need the vaccines, we need aggressive risk mitigation measures with our own behaviors, we need the therapeutics, we need testing, we need contact tracing. And finally, we are seeing these things, you know, start to come together, but we still have a long way to go. And again, still our best defense is our own behavior. So we just need to double down.
Yeah, going back, there's a question here. Do you foresee rapid home tests coming out anytime in the near future? My concern about home tests, honestly, is you really need to talk to your doctors if you have a reason to test. Why? It's because this is complicated as heck. And the number of patients I've had who, it's a little scary when everybody says, I've got the world's smallest bubble, and the person in my bubble now has COVID. You know, there's a lot of people who now have exposures and some, you know, is it a close contact or not? Talking through that. What does that mean? What are your risk factors? Why are you testing? And a ton of people who've had a true high risk contact who believe they can get out of quarantine with a test. If you've had a high risk contact, I'm sorry, it's 14 days, right?
That is such an excellent point, Clay. I am seeing that all the time. People have a high risk contact, they get a test, they think they're done.
Yeah, it's the most dangerous thing you can do, right? The virus can incubate for a long time. There's a reason why 14 days got set up, all right? So you can't test yourself out of quarantine. There's a reason why I like to test people with high risk contacts twofold. One is if you're still asymptomatic on day 7, or you said, you know, day 4 to 6, I'm sort of like maybe 5 to 7. It varies a little bit, but you have to wait at least 3 to 4 days, or if you have any chance of catching, you know, real virus. It can be helpful to make sure other people in your household, right, who've been sort of avoiding you, have to breathe a little bit of a sigh of relief.
Yeah.
You have to stay home, but okay, you know, mom is now, you know, she had that high risk contact. It's been a week. She had a negative test. She's going to have to stay home for another week. But at least, you know, we're not sweating bullets that suddenly mom's going to, you know, get us all sick. There's still a chance.
There's still a chance.
There's still a real chance. So you can't test yourself out of quarantine.
Yes. I think that needs to be on a billboard, or the Goodyear blimp needs to put a, you know, fly around with that message that you can't test yourself out of a quarantine, 14-day quarantine after a contact. You cannot test out of it.
And so the home-based testing makes me nervous, even though I love like LabCorp Pixel. It's a PCR test. You get it mailed to you, you mail it back. Seems reasonably accurate. The rapid tests would be even better. I would love everybody, all of my patients have a ton of little rapid COVID tests at home. They just have to call me before they use it, and we talk about what the result means.
Right. Because context matters so much. And I do think, I mean, I'm a big fan of the frequent rapid testing a la Michael Mina at the Harvard School of Public Health. But as with everything, context matters. So, you know, if people start using those rapid tests, like you said, one of, and think that they're, you know, it's a green light, that's dangerous.
Yep. Absolutely.
And I think that's why the FDA has hesitated on approving them, right? A, because they're not that sensitive for the presence of virus. They're pretty sensitive. They're very sensitive for infectious levels of virus. But B, because I think they're well aware that people will, you know, inadvertently, inappropriately use them. But I do, you know, it would be great if we lived in a world where everybody could have access to those and understand what they meant, and everyone had a doctor they could go through the context of their use with them. But
I mean, a pregnancy test is pretty simple.
Yeah.
Right? Either pregnant or you're not. Even then, there's been a lot of issues with those home tests. Okay, do they interpret the plus sign right? And so negative for COVID or positive for COVID, even, you know, what does that really mean? And so, you know, I think home-based testing is also good, especially for people who are symptomatic, as you say.
Yeah.
You know, is that symptom COVID or not? But hopefully you can go and get tested by your healthcare provider.
So if you have symptoms, you can return to work 10 days after the first day of symptoms. Quarantine is different. Quarantine is when you've had a contact.
Yep.
Because it can take up to 14 days after an exposure to get infected.
Yeah.
But once you develop symptoms, if you're sick and or you have a positive COVID test without symptoms, you have to isolate for only 10 days. Now, people are confused. Okay, I'm sick, but it's only 10 days. I'm not sick, so it's 14 days. How does that possibly work? Well, if you think about it this way, by the time you are sick or test positive for COVID, you have already, there's been some time that has elapsed between your getting exposed and developing the positive test, developing symptoms. So the arc of the virus is that, you know, you get exposed, you don't have any symptoms, the virus is incubating, it's incubating, and then you test positive or develop symptoms. So the 4 days prior, you know, have already passed.
Really well said. Yeah. And
Did I say that well? I was.
No, you
trying
did.
to-
I think
okay.
it's your incubation period is done, right? Either positive test or symptoms, you're on the 10-day clock because your incubation period is done. Now, if you're hospitalized, the clock is longer. It's actually 20 days.
That's right. That's right. That's why there was the whole thing about Donald Trump is like, shouldn't he not be back after 10 days because he was more severe and more severe cases?
On the 20-day clock, but I think the 14-day quarantine, right, which is you've been exposed, you got the incubation clock churning, right, different than the isolation clock because you have it. We know that you have it now. You're isolating, which is different than quarantine. It's also like the great example of the college student who comes back home with COVID, right? Sort of symptomatic, doesn't really tell anybody, boom, gets members of their family sick, right? Then they clear isolation fast. They're free as a bell. Now the rest of their family is on their 14-day clock, right?
Right.
The person who just came home is now free to leave the house. Then, oh wait, you start getting symptoms on day 10.
And the clock starts over.
And so it can be absolutely brutal.
Right. It's another example of college students fleecing their parents and breezing in and out with COVID and then leaving a trail of despair behind them. No, I'm kidding. I mean, but it is, I mean, this is what's happening and this is what's going to happen at Thanksgiving is young people, and I can't believe I'm old enough to be saying that, but I guess I am. Young people are going to be gathering together home from college. And, you know, hopefully they won't, but, and then they'll be bringing it home to their parents, their grandparents, and it's, you know, it's like touching flypaper. It's just hard. It's hard to get rid of it once you've got it in a household. So, you know, you got to figure out what you're going to do. You're going to have, you know, some unpleasant conversations with your college age kiddos, teens, and help them understand that everything they do affects everyone else in the house.
Yeah, and this is that's the problem with the pre-symptomatic spread. All right, it's just, it can go so fast and go several steps before anybody shows symptoms. You just have to be careful about that. There's a question here about testing in schools.
Yeah.
About, you know, like public versus private, different regions. It's tough for me to know. I'm not tracking all of the testing policies in the various regions. I just think it's safe to have schools be open without a surveillance testing program.
Yeah,
I do. I mean, you just have to have faith in the protocols in the school to make sure when someone's walking around the school with COVID, they're not getting other people sick, right? Washing hands, wearing masks, good ventilation, distanced. And so, you know, testing is fine, and a surveillance testing program can actually really help reduce the spread of the virus in a broad community, but I don't think it's a necessary step to make schools a safe environment. That's just my 2 cents on that.
I agree. Let's see, what other questions do we have? Oh, these are some really good questions. Oh, Julie had this comment about holding on to hope, but it's sometimes hard not to be consumed with anxiety. Yes. Welcome to the club, Julie. Yeah, I mean, one of the things I end up talking about with people in my office for sometimes the majority of our conversation is this fear and anxiety and the vulnerability that we're all experiencing and how to manage it. And that in and of itself can become a health problem because anxiety tends to be channeled in the way we sleep and eat and treat our bodies. So again, one of the things that I think she was mentioning in her question here is limiting your media exposure, you know, limiting all the inputs that can be extremely stressful. And then figuring out who you trust, finding a few people who you trust, and then getting outside in nature, while the weather is still nice, and even when the weather isn't nice, get outside, even if it doesn't, feel like you want to get outside. If it's cold and rainy, still take a walk. Try to move your body every day. Get some sort of physical activity. It doesn't need to be in any formal way. It doesn't need to be in fancy, expensive yoga pants. Just exercising most days of the week. Prioritizing getting 3 good meals a day. They don't have to be Pinterest perfect, but something nourishing morning, noon, and night. And then, as we were talking about earlier, reaching out to the therapist, reaching out to your friends by Zoom, sitting outside around a fire pit with a neighbor, masked, distanced, and then knowing hope is on the way, because it is.
It is. It is.
Help is on the way, and hope is in the air, I should say.
There was a question I missed about metrics.
For schools?
For schools to close.
Yeah, this is a good one.
It's a tough question to answer. I've got there's no red line in my mind where you say, okay, the test positivity rate is X, or the number of new cases is Y, or you now have had Z number of positive cases within a school. I do think that parents should make that individual decision on their own about when they want to keep their kids home from school, right? Which is different than should the schools close, right? In theory, again, if every single student walking in that door has COVID, in theory, it should still be a safe environment if people are wearing masks appropriately, good ventilation, and hand washing. It should, right? So the amounts of virus around in the community doesn't change. However, do you trust your child? Not that it's not no judgment of them, but are they the type that's going to go drop their mask outside during a break? Is going to school a carpool? Terrible idea, right? And there are lots of aspects around school that are not necessarily a great idea. Do you have high-risk people in your household? How much is it necessarily harming the psyche of your child to be stuck at home? I'm optimistic about what this spring is going to look like. So if you want to say, hey, after Thanksgiving, even if schools are open, like, just please don't go, like, that's a fine and perfectly reasonable decision in my mind. But it's hard to put a red line and say, this is when schools need to close. It's a very important individual decision of when I want my child to stay home from school.
Yep. And Emily's point is well taken. Teachers also should have a choice as well. I mean, some teachers are higher risk than others, and it comes down to a very individual decision between you and your family, and you and your doctor.
Agreed.
Someone's asking me to tell the story about Al Gore and the piglet. That is so funny. I wonder how that came out. I did a Facebook Live with the Washington Post columnist, Alexandra Petrie.
Okay.
And it's so funny. When I was doing this intro talk with her, that I didn't know other people were on the call. I was talking about this story from high school where my best friend, who's Al Gore's daughter, and I had a contest where one of the faculty members had to kiss a pig in front of the school as a fundraiser.
Yep.
Anyway, so someone's asking me to tell that story, and I don't think we have enough time right now, but I will definitely tell that story another time.
I think there's can you catch COVID from pigs? Maybe. So is kissing?
Can you catch it from pigs?
I don't know. I mean, that would be the context of why it's an appropriate story.
That
right?
Now it makes so much sense as to why would we be talking about it. Plus, it was a funny story. That anyway, so I think that this was you guys have great questions tonight and great comments. It's
always good, but this is
smart group.
A lot of us,
and I think we should keep talking. I kind of feel like, does it feel like this to you, Clay? We've done 9 of these, and back in the spring, there was so much information coming at us like a water out of a fire hydrant, and then there's a bit of a lull, and we're sort of settling into this new routine, and now the news and information is kind of picking up, as are the cases. So maybe we do this again in another 3 weeks, as we have done, and we'll see what we have to report. I have a feeling we'll be talking about an increase in cases post Thanksgiving. I mean, I don't really have a feeling. I'm quite sure that we'll be talking about that. So,
I mean, honestly, if that's not the case, some crazy miracle would happen.
Right. Some miracle has happened. So just as a cautionary tale, just be sure that you're not one of the people in those statistics, because it would be really a miracle if it didn't happen.
Yeah, it's a real concern. Just one side note quickly. that I think is with the CDC finally coming out about masks, protecting not only other people, but you. Just remember that one reason that I think that the mortality rate has come down, there's lots of reasons for it, is because of mask wearing. If some people who may be in a really high risk environment, they're weight wearing, and there was a question we didn't really talk about mask types,
Oh, I
cloth
saw that from
masks
the
and
beginning.
whatnot.
Yeah.
Yeah, I mean, I think there's plenty of resources out there about, you know, multiple layers, tighter weaves, cloth masks, if they can really seal well and you're comfortable, are probably pretty good. I happen to be a believer. It is more expensive, but I do like some of the KF94s or KN95s. The surgical masks, you know, can work well too. But let's just say they're not perfect and you get a little bit of an exposure to some of the coronavirus. That makes your case less severe, right? So just remember that. That's the Swiss cheese model. Keep putting those things in, and that matters. So just in case you get caught, or you get caught in a high risk environment, right? If you've got the basics covered, you're going to be fine.
Yep. The great note to end on. We will put this, I will put this on YouTube. So anybody who wants to share this with their friends, please do. And know that Dr. Ackerly will be back with our 10th
All right.
episode in early December.
Double digits. Look forward to it.
Double digits. All right, Clay and everybody, thanks for joining
Good night.
us. Okay, bye.
Bye.